was looking like this. We just kind of saw our face at the bottom of our screen.
That's fine with me.
Yeah. I got to see you. Got to see you good. Mama Ruth, you looking lovely this morning.
Even better.
There we go.
Ooh, I love that.
Music. That was a get rid of allergy music. So I don't know. Oh, we're live.
Good morning, everyone. Good morning. How's everybody doing? I love that mask, Medicare for all. I gotta find my blue one.
Yes.
Ooh, you got a black one too. Cool.
I do. Yeah. Well, good morning, everyone. Welcome to Coffee and Panduce. Today is March the 3rd. We are in the month of March. I believe spring has started here, but you know, we are in North Carolina. We could get a freeze, I guess, before, you know, the freeze point, I think technically is sometime in March here. But today is March 3rd.
Really?
Memorial Day.
When is it? Oh, no. Oh, yeah. Probably here. You never know with climate change. Welcome, everyone, to Coffee and Panduce. I'm Christian County, one of your co-hosts, and we want to go around the Brady Bunch screen, let everyone introduce themselves. Thank you for joining us on Facebook Live, but also those who join us on YouTube and also on Facebook later on as well. I want to thank you so much for joining us. Today is a special show for many reasons. We'll talk about that here, but the main topic of our show is how COVID-19 has changed America. We want to talk about the many changes maybe in our lives, and there's a lot going on around the world around the country with immunizations and the new vaccine coming out. Also, we want to end the show talking about someone who is very special to all of us, and we will be doing a tribute to him next week on a Thursday, and I'll give the date as well at 9 p.m. Joe Oldham was a Charlotte native. He was on our show 11 times. Unfortunately, he passed away here in Charlotte last week. He will have a candlelight vigil in Charlotte on Friday evening. We'll give the details of that, but also we'll have his family is having a viewing on Saturday at St. Paul's Church, I believe. I'll just double check that to make sure. And we'll talk about a little bit of him. We'll end this show with the first time he was on this show and the topic, and it was just amazing to watch this old soul. He's just a wonderful young man. And then of course, we'll do the tribute to him after his family has opportunity to honor his life as well. So with that said, let's go around the Brady Bunch screen, introduce yourself and your imaginary button. Anybody got the Brady Bunch screen up? I'm looking at
Steve, Dr. B, Barbara, and myself.
All right, let's do it.
I am Steve, the resident hay fever sufferer at the moment. So if I seem a little bleary-eyed and sniffly, my apologies. I am a longtime guest of Coffee Pan Dulce, the recording secretary for the Libertarian Party of Mecklenburg County, and an all-around great guy. Very humble.
Yeah.
Am I next? I'm George Bohmfalk. I'm a retired physician. My number one button is Medicare for All. I want to mention a brand new book that just came out. If you want the long and short, every little thing you need to know about Medicare for All, this book is wonderful. Prior to this book, it was hard to get all the information in one place. It's a very nice, easy read, no charts or graphs to confuse anybody. And I'll put on the Facebook thing a link to where you can get this on Amazon. So it's a really nice book. My other button is Medicare, is Black Lives Matter, which I think is the issue of the day. And it's interesting how racial justice intersects with healthcare justice, with all the racial disparities that we're all becoming painfully aware of, particularly with the COVID affecting minority communities and how the minority communities are not getting their vaccines at the same rate as affluent white communities. So these are all huge issues that intersect. And so I'm working on both of those.
Hi, good morning. I'm Barb Bacon. I'm a healthcare advocate here in South Charlotte. My two buttons are, I would say healthcare for all rather than Medicare for all, and Black Lives Matter. And maybe I'll add my third. We had another incident in my hometown with a shooting. got to do something about guns, but where do you put it on the list of everything that we need to do? I don't know, but it's been a wild week, and looking forward to the show today.
Good morning, everyone. My name is Ruth Perez. I'm a community advocate. I'm a co-host here for the past almost 3 years with Coffee and Pan Dulce, and it's always an honor to be here. I don't know, I woke up this morning very sensitive. Thank you, Barbara, for reminding me about what we're going through in our city. I love Queen City. I love Charlotte. I love our Carolinas. But it's been tough for these past years with the gun shooting, and a lot of lives that are innocent, that don't even have to pay the price, are paying those life prices. And that's my number one. It's been my number one button for the past, I can't remember, probably 4 years when I started advocating. We need some gun sense reform. My second button is always Medicare for all. As y'all know, I haven't been feeling very well. I ended up in the emergency room last Monday, and now I'm owing over $10,000 for all the tests that they ran on me. So we definitely need to make a change. We need to see a change for our low, I guess, uninsured families counting with me. And my third, I support Black Lives Matter. I'm a color person. I'm a minority. My kids cannot walk out in the streets with a hoodie on because they're in danger. So we have to do something about it. And that's about it. Next.
Well, thank you. Once again, I'm Christian Cano, one of your other co-hosts on this show, and my buttons are Medicare for all, a very important topic that becomes even more and more important, seems like, as things have happened here in America. Also, Moms Demand Action, gun sense legislation. Also, what Mama Ruth has been talking about. Many people who are members of Moms Demand Action are gun owners. They just believe in responsible gun ownership, trying to prevent suicides, those kind of things, accidents, guns being stolen from cars that are used in crime. And then, of course, as we have been saying, Black Lives Matter. It's a very important issue for many of us who have been educated on this show, but also who understand how important it is for equality in Charlotte, but also all around the country. So with that said, let's make sure that we follow what I'm supposed to do and salute to Coffee and Pan Dulce, to our neighbors. If you have something you're drinking, bourbon, Stephen, or whatever for your cold or your allergies.
I got clear vodka.
Yes, yeah.
Maybe an Irish coffee or a hot toddy in the evening, but just sticking with straight Ethiopian coffee for now.
Oh,
don't make fun of me. Believe me, with this shoulder pain, I prefer drinking all day long.
Hey, it's COVID.
I'm just kidding, guys. I'm just kidding.
People are doing that. There was a skit on Saturday Night Live about all these millennials who are at home just drinking all day long, doing their.
I can think of a few back home.
Yeah, that's right. So we also want to thank Manolo's Bakery, who is our Pan Dulce sponsor. If you can see that, Manolo's Bakery in Central Avenue. Please support your Black and Brown and all small businesses during this local global pandemic. So thank you so much. We are going to talk about the COVID-19. How COVID, that's the name of our topic, how COVID has changed America. At the end of the show, I'll have the dates for the candlelight vigil, the viewing of Joe Oldham, and also our tribute to him next Thursday, a week from this Thursday. A couple of things that have been going on around the country, and we'll let everyone kind of go around, and we've got Dr. B back with us. Thank you so much. There's a new vaccine that has been approved that is coming out by Johnson & Johnson. My understanding, I talked briefly with our resident learned individual, Stephen, before the show. It's a different type of vaccine than the first two vaccines. It's a one-shot vaccine, but it's a different type. My understanding is that has been coming out this week. Everyone, a lot of the states should be getting them this week, I believe, and next week. The state of Texas made a very surprised announcement yesterday. It was so surprising that the superintendent of schools or the public education was so caught off guard. They had no idea how to respond. They are releasing the mask mandate. They're also going to start rolling back some of their safety precautions or requirements. It's going to be interesting in Texas. South Carolina has announced they're going to start they still have their mask mandate, I believe, South Carolina, but they're going to start opening up. Basically, everything is opened up. I think if I understand. Go ahead.
Mississippi as well. My goddaughter's in Mississippi, and I texted her and she goes, "Oh my God, Miss Barb." And I'm like, "Wear your mask, Emily, wear your mask, wash your hands. You've got to be diligent." She says, "I want to come home for spring break." I said, "Then nothing changes for your life. You got to," she says, "I'll be ostracized in my dorm." And I said, "You can't care about that. Your mom won't let you come home."
Yeah, it's going to be, for those of us who have family in those states. I mean, I started to think about Stephen last night, my more libertarianism in me, because I was really angry when I heard these on the news. And then I went, all right, it's their state. They voted for their governor, let them live their lives. But of course, I'm angry because I'm like,
I'm very proud of you for having such a good point of reference and point of view on that.
Well, kind of like what Mama Ruth kind of talked about. We have so many issues that many of us are a part of, whether it's gun sense legislation, whether it's Medicare for all, whether it's racial justice, social justice, affordable housing, all of those issues. And they're also important to us that it does bring out the energy in us when we see things aren't moving fast enough in one of those areas. And then you get to the point, why even do this? But then you remind yourselves, we need all these soldiers in these fights to move things forward. So we want to talk about all those things. There was also an article, because we're getting around the 1 year anniversary. I think today is the 1 year date of the first, I don't know if it's the first death. I don't know if anyone knows, with COVID-19, or the first reported case.
Yeah.
There's something.
Washington
The
State.
first death,
Yes.
not the first reported case. The first reported case was back in January.
January, yeah.
Okay. So today is a 1 year date, and I think next week we start to get into the 1 year of stay-at-home orders that occurred in New York, and then we had it the weekend before. It was the weekend after Dr. B was first on our show and talked about COVID-19. That weekend, I went to Atlanta, and then when I came back, we immediately went to the safety stay-at-home order. If I believe that. So we're coming up on the 1 year anniversary, how this has changed everyone's lives, from stay at home to working, how we, just all mask mandate, all these kind of things. There's a lot going on. So let's try to keep this in 30 seconds. And as I was going back and watching all the Joel ones, I remember the first time he was on, he said, all right, 30 seconds. And then he went 3 minutes. So so Joel was part of us. So let's go around and tell us how what you've noticed. I mean, there's a lot noticing, and then we'll kind of ask specific questions about the viruses and the people who may not be getting the shots that we kind of talked about before the show. Who wants to go first about how things have changed in the last year? I mean, the fact that we're doing this is one of the things that's changed. Right. So who'd like to?
I'll go briefly for 30 seconds. So one thing I've noticed is that, mandates are all well and good and all, excuse me, but, I work in retail and, customer facing almost all day long, and only a fraction of the people that I encounter every day even wear their mask properly. Right. So because only a fraction of people wear masks properly anyways, it's very likely that mask mandates don't work because people don't wear the masks properly, which is one of the reasons why you might see kind of all over the map information on how states are doing, right? If you look at the statistical data on how states are doing, it's kind of up or down. You can't really tell where mandates are, what states did do or don't have mandates. It's all over the map. And so it seems like more people should have this idea that their own safety is really their prerogative and it's on them to keep themselves as safe as possible, and the government is less able to do that than many people would hope. And I certainly hope that's a lesson that most people take away from this, so that in the future we can do best practices of our own volition, and independent of what bureaucrats, politicians, good or bad, would have us believe or say.
If when you say you're, facing people and stuff like that, and when you see that they're not following those mandates, how do you feel about being, in the political, how do I phrase it? Not talking about Democrats, Republicans, or, independents or libertarian. How do you feel as a human being knowing that there is a pandemic? Some of us didn't believe it at first. We had to go through certain situations to be able to get into the role of the truth of there is a pandemic.
Mhm.
How do you feel knowing that you're risking your own life, your own family, your own health at work, going every day and seeing that people are not following those directions and they might be carrying the virus and getting you or your family sick?
The most dangerous thing any of us do every single day is drive our car. And we don't freak out about it because we do it every single day and we're used to it. The fact that an illness is novel and new, you know, that freaks everybody out. But it doesn't mean that the actual danger that's there is any different from life. I could have an aneurysm tonight and then just die, and that'd be it, right? There's no use in worrying about it. Diseases have been with us since the beginning of time, and I'm not worried about it. All I can do is control the things that I can control, and I do that as best as I know how. And then, we are more like there's an old phrase from Stoic tradition, memento mori, remember thou art mortal. So I remember that mantra often, and I whenever I have an instance of frustration or fear or an existential crisis of some kind, I go back to that mantra, that teaching in Stoicism, and it provides me with, I guess, a sort of frame of reference. And I don't get too amped up about it because I can't control what other people do. And even if I could, I wouldn't even want to. If I could influence and motivate somebody to wear the mask properly, sure, especially if I see that they're overweight or they're buying cigarettes or they're in very poor health because I don't want them to be ill. And so I am a big fan of living by example. And so, I make sure to wear my mask at work in a proper way. And that's the best I can do. And if someone wants to do something different, that's fine. But Mama Ruth, to answer your question, I don't let it bother me.
Okay. Who else wants to, Dr. B or Barbara? Go ahead.
Dr. B.
Yeah, I think it's going to be really interesting 5-10 years from now to read the book about the pandemic, because as Stephen said, it's hard to keep track of what states are doing what and how that's affected the course of the illness in each state. So that's all going to have to be sorted out. But I think there's going to be kind of 4 things that people are going to look back on this and really kind of say this was a thing that changed America. One is, like you said, what we're doing. I mean, that everybody's meeting by Zoom. I mean, we've all participated in seminars and discussions across the country that we wouldn't have been able to if we hadn't been forced to move onto this new platform. And all these people working from home and questioning the value of going to the office and traveling across the country for a meeting, that's going to be a real reassessment. And we all want to get off of Zoom as soon as we can, but you got to admit it's got its advantages. So that's going to be one. The other is in the medical world, telemedicine. I mean, just like we're doing, you can go see your doctor. And a lot of mothers of babies will be able to show the nurse the rash that they're concerned about and be told, oh yeah, come in, or it's nothing. I think telemedicine is going to be a great legacy of this year and long overdue. The other thing is I think there's going to be a hard look at realizing, in the absence of it, the value of some degree of from the top government leadership. Because I think we just didn't have that this past year. And I think we've had a whole lot of unnecessary deaths as a result. So all these people say, oh, we need small government and everything needs to be local. I think we're paying the price for that. So yeah, that could be debated till the end of time. I mentioned earlier the thing about the racial inequities and disparities that have become so obvious in the face of COVID, and particularly with George Floyd and other police, murders of minorities. It's interesting the timing of how that's come along with the COVID. And then the last thing is the remarkable development of the vaccine, in vaccines plural, in such short order, with cooperation that's never been seen before in the scientific world. So I think those are going to be, I said four, those are going to be 5 big takeaways. That's it.
Excellent. Barbara, you want to jump in?
I think for me, personally, I just started to date somebody. How do you date in a pandemic?
That's right.
Fortunately for me,
Well, it's safe sex, isn't it?
Video, Zoom.
yes, we does stay in place. Yeah. But fortunately, we have the same backgrounds. We came from Catholic families. We came from the Midwest. We liked football. The first thing we worried about, oh my God, are we going to have football? But for me, I came from the pharmaceutical industry. So I was always really interested in what was going on with the vaccines. And that was my focus. And that kept me going. And as Stephen said, I wasn't getting angry about things. I virtually made the decision, because of my pre-existing condition, to stay home. So that stopped a lot of my interaction, and some of my neighbors were going out and doing crazy things, but I did not get involved in that. I said, no, no, no. So that was my choice. But the other things that happened, new friendships because of this, through Zoom, through trying to follow up with people about their health, and I was worried about them and trying to help them in any way that I could with my own connections. That was important. And then the newest thing for me is trying to help people get over their vaccine hesitation, because just lack of education or mixed messages. And yesterday I had one of my relatives call me to check to see how I was, because I got my second dose on Saturday.
Oh.
Very angry with the Catholic Church because they're telling people not to get the J&J vaccine. I about blew a gasket. That's the maddest I've gotten during this thing, because I just started to get back into church, and now I'm like, done. I just, and I'm going to get mad again, so I'm not going to say anything else about it, but that went through my family like wildfire. I had so many texts. My brother called me at 10 o'clock at night, and that's like, you don't call me at 10 o'clock at night. Did you hear? I go, yeah, I heard. He goes, oh my God. I said,
Barbara, let me ask you about that, because, I understand that the Pope has kind of said, take a vaccine. This is not an issue. And now some archbishops are saying quite the opposite. So who does your family listen to the head guy or the guy that's closer to them?
They will probably listen to the local people. And I'm like, you're killing people with that attitude. Is that what you want to condone? And the reason they called me is I'm a straight shooter about science and what I think is right. And I said, I'm a vaccine person. We have family members that had their life saved because of this. You need to think about that. If the Pope said, take a vaccine, that's who you should listen to, the local guys. It's political, it's personal. We know this. Don't ask me again. I'm done. So
Yeah,
really, because,
that's a very important point that Dr. B and Barbara made, because we kind of talked about this briefly, and we have to put things in, understand that it was one archbishop for the area of New Orleans. It's the only one that has said it. Maybe there may be more who will come out to try to follow that, the more conservative archbishops who have probably been this way about many things within our church, or within the church. I'm Lutheran now, so I'm Catholic light. It is important. But we talked about this briefly with Stephen, and even within my own family, and I'm sure we have this in all of our families, a lot has changed with COVID-19. We're doing these things. We've run elections during Zoom, so we know we can do those things. It changes the way we fundraise. If you're a candidate, it changes the way you campaign. A lot of the things that you didn't need to do, now you're realizing I didn't need to do that. Now I can just do a Zoom call and get people from all across the country. It's allowed us to communicate. I'm talking more with my family more than I have ever in my entire life, which is a good thing. It's a wonderful thing. I'm learning how to cook old family recipes. We're doing so many things. Do I miss being around everyone and shooting the breeze at a sports bar? Yes, but I'm saving money from sports bars. I'm saving tons of money. So there's a lot of things, pros and cons. But to Dr. B's point also, and Barbara as well, kind of, because that's kind of the dynamics of the church as well. It's one of those things where we look back, and as a libertarian, and Stephen and I and our other former co-host, Jeff Scott, there's a lot of things I love about libertarianism and being from Texas, but there are certain situations where that philosophy just doesn't work to my advantage to keep me safe. And that is—
Give an example.
Yeah, to Dr. B's, I want a stronger governor who directs healthcare policy, and it comes down so there's an organized effort, whether it was for
Like with
testing.
Andrew Cuomo, who killed like 16,000 people with his policies.
Well, we can all have antidotes, and that's not
I'm
what
not
I'm—
sure of that.
Yeah, see, I'm not going to do that, and that's the problem. If the response to that is, well, I know you are, but what am I? That doesn't work with me.
It's a valid concern though, right? Because here's the thing. If you have the freedom to choose, you have the freedom to choose.
We gotta understand that as the leaders, we're never gonna be satisfied as people when somebody's in leadership, because they try their best to do what they can.
Yeah. No, this is what I'm saying, Stephen. That's a good, valid concern for you, and that's wonderful. I'm talking about me. So because I'm telling you doesn't mean that's less concerning to me. So that's something that you can tell people that that's something that you're concerned about, but I'm just telling you about me. So for me, that philosophy just doesn't seem to work with me. And so that's one of the things that is concerning for me as I look back at this. And so, if that's your, how you want it, that's great. That's wonderful. But libertarianism is I don't tell you what you should believe and you don't tell me what I should believe, right?
Yeah, I think we can all agree that more transparent information up front, concrete information is all around a good thing, right? So, because how can we make good decisions without good information?
Right.
Well, I think many people can agree with that. But I'm saying is that I'm very fortunate that, and as I look at my family in Texas and Florida, I'm very fortunate that we had a governor that is he as strong as I wanted him to be? No, but he was much more rational and adult than in my
Many others.
Yeah, so I'm fortunate that I live in North Carolina at this moment than in Texas or in Florida at this moment. And so those are things that kind of, that I'm looking at this time. But when we get to the vaccines, this is really kind of gets into it, because I know we talked about this before, Stephen, right before the show, that there are probably about 3 types of people that aren't going to be taking the vaccine. And it's people with maybe immune deficiencies. Was that one of the—
Yeah, at least I know, and this is specifically talking to information that came out from the NHS in Great Britain, where if you're going to get the vaccine and you had like an like an immune system issue of some kind, or allergies or whatever, they wanted you to be in a facility where they could treat anaphylactic shock. Like that was put out by the NHS.
Sure. And then the other one
in
would
Britain,
be—
mind you.
Yes, and that was another one would be people who maybe not want to do it for religious reasons, which would be someone who maybe took the word of the Archbishop in New Orleans literally over the Pope. That would be another type of person.
Yeah,
And then the
Catholics,
other—
for example, who are concerned about the stem cell research that may have been used in deriving this vaccine.
Yes, and then the third one, which I'm glad you told me the name of this, because I didn't know what they were called, but I think we were calling them free riders, people who are just waiting for everyone else to get it. Is that right, Stephen? I mean, that would kind of be like—
Yeah. It's like, hey, well, I don't have to do it because everyone else is doing it.
Yeah. And so those are the 3 groups that I think— I know you call them free riders. I call them "you're not the boss of me." I mean, I know I shouldn't use that, but that's
potato.
I know. So those are the 3, and kind of like we talked
There's
about—
also followers as well that don't even know what's going on. They don't even know their system, and they go and get it done just because somebody else is doing it and they want to do it.
And so I guess the goal is, and I'll go back to Dr. B on this as a physician, is the goal to, because we know we're always going to have those individuals, is the goal that there are more of the other ones,
Yep.
so that way we can reach that necessary percentage of people who are vaccinated or have developed immunity. I mean, that's my fear a little bit, is that there may be, I don't know if it seems like there's a lot of them because of social media and we hear about them a lot and the news always does stories on them. Are they, what do y'all think? What percentage of people do you think, is that something we should worry about? Or is that just me being a worry wart that people will take vaccines, but there'll be too many? Go ahead, Dr. B.
No, I think it's a huge concern. And, I've been reading things that, like, in the military, they're like 30% of military enlistees that don't want to get the vaccine. That's a huge number. So yeah, I mean, yeah, it's a problem. And if you look, going back to the polio and smallpox and measles and all these kind of things that we've had vaccinations for, it's critical to get a certain percentage of the population protected. And if Fauci and all these kind of will differ, whether that's 60%, 70%, 80%, kind of whatever. But you have to get the number down low enough so that once we get to interacting freely, like we did before all this, that the chances are not very high of us running up against one of the persons who might be carrying it and allowing it to spread. So, yeah, it's a big concern. And I'm optimistic that as people are making, outreach, and a lot of celebrities and sports and church and other kind of people are reaching out to their populations and trying to educate them and allay their fears. And as time goes on and people see, oh, well, there wasn't any kind of reaction. And as more bad things happen, I mean, there's stories all the time about people that maybe kind of put it off and then bing, they get it and sorry, they're dead. And those are very real stories. And, I keep going back to, do you get in your car and not put your seatbelt on? Probably not. And if I keep making an analogy that this is almost kind of like warfare. And, if somebody gave you a helmet and a protective vest, would you not wear them if you're out and people are shooting at you? So I don't know. It's so easy for people to minimize the threat of this until it happens to you or someone you know and love. So yeah, we need to keep banging on
the
this.
unfortunate part of it. There's Friday morning Zoom calls. There's some guys that are, we're not going to get the vaccine, and we're like, until you have somebody in your family that gets it, or until you have somebody in your family that dies, that's what it's going to take for you to maybe change their mind. And they said that maybe, but probably not, and those are the kind of people you have to get along with and just learn to say, okay, they're entitled to their own opinion, but at some point they're going to get ostracized.
I have the similar situations where some of them are saying, well, I haven't gotten the virus. I haven't gotten sick. I have not had any symptoms or anything. Why should I get it?
Yeah.
What's going to make a difference? And I'm like, you never know. Just protect yourself and protect your surrounding. If I would have that right age, I would have gotten it already. I mean, I don't mind getting it, but I can't get it right now. So too bad.
I mean, there's a good argument to try to encourage people who are in vulnerable categories, right?
Mhm.
Encourage them to get the vaccine, encourage them to do safe things. I mean, but there are going to be people who don't want to get it for their own reasons. And what's the alternative? Hold them down and force them to take a medicine they don't want? I mean, no one's going to agree to that. So all you can do is try to be persuasive and encourage people. And take precautions on your own. Be as safe as you know how to be, right?
We can't blame them either. We cannot make them feel guilty about anything else. I mean, that's their personal choice as well.
Yeah, because if you start like criticizing people and oh, you're the reason why grandma's going to die or whatever, that just puts up their hackles and it shuts down any kind of conversation.
Yep.
So I mean, there are things that can be done, right? Like, for example, people who are healthy have a much, much, much lower risk of having serious side effects or death from this disease. So encouraging personal health is a good idea. If you know someone who smokes, encourage them to stop smoking. If you know someone who's morbidly obese, encourage them to try to get healthy. Like, these are things that they can do in addition to the vaccine. And that's a good thing to do.
Don't you think that's going to be, Stephen, to your point, and I know Dr. B probably, this is one of those times when we're talking about things where he just wants to shut his computer off and go, I've heard
we don't want to do that. We like having you around, George. Don't leave us.
No, because I can sense a highly trained scientist, physician, and lay people are saying, the doctors don't know what they're talking about. That would be like if I was an engineer and someone
I don't
going,
think any of us said that though, right?
no, I know what you mean,
But
but
there are people saying that.
kind of like, when people are special, it's like
There are people who think the world is flat. It doesn't mean we give them any credence.
Yeah, we're nothing. No, we're nothing compared to what most people. I guess I'm just saying is that I think
The world is flat. It doesn't have no corners.
I think one of the things that we're going through now, and Jenny talked about this a lot, about how one of the things that COVID has done, it has brought out some things that maybe we didn't know in people, and some things that we needed to see in people. And I'm not saying negative or positive. I'm just saying is that there are many couples that are realizing we shouldn't have been couples, because I don't want to be with you 24 hours a day. And there are many couples that are saying, I'm so glad. No, and there are many couples that are saying, I'm so glad I picked you. We are really compatible. Now just go away for a little bit. There's a lot of things.
Put another room, please. Yeah.
Yeah. So everyone is really finding out about themselves and finding out about family members. There are family members who they have stepped up to the occasion. I thought they were more libertarian than me. And they're the ones that are really cautious people now in Texas. And then there are individuals that I thought were more the free loving ones. And they're like, a little bit different. So we're finding out a lot of things. That's why I just think that everyone should just take as a necessary a Myers and Briggs test. Does anyone know what those are?
Yeah.
Myers and Briggs test are professional personality tests that people are given in their industries to determine in an emergency, how do you react? And they do that in the hotel business, because we want to know, is a manager going to panic when a fire happens, or is a manager going to go, all right, everyone, stay calm? And most people who show confidence panic in an emergency. And so you want to find those people who remain calm. And I know Stephen may not agree with this, but Governor Cooper is one of those persons who I feel remain calmer than some other individuals.
Right.
And that was.
No, I agree. He stayed calm. I just don't like his policy. There's a difference.
Yeah, no. And there were other governors who did not. But Dr. B, you want to say something? You raised
everybody talks about Governor Cooper, but I think what really is beneath Governor Cooper is Mandy Cohen, the head of the Health and Human Services, who was kind of the number 2 consideration for Biden's pick to be the National Health and Human Service. She is a phenomenal person. Yeah. And there are others around the country too. In fact, when I'm up in Ohio or somewhere, basically kind of had to quit her job because she was standing up telling the truth, but her governor was Republican, and she started getting too much heat. So Mandy Cohen, I think, has a lot to do with Governor Cooper's policies and positions and leadership and things like that. And just kind of as a joke about your thing about this test, one of the best books about healthcare or about medicine in the United States, it's a very biting satire. It's called The House of God, and they have 10 commandments. And one of the commandments is, in a code arrest, when the lights go off and somebody's dying, take your own pulse first. And that speaks to exactly what you're saying, that if you're not calm in an emergency, nobody's going to be calm. So I love that. Take your own pulse first.
Well,
and I guess deal with the emergency.
Yeah, isn't that the airline thing where they say when the air comes down?
Come down.
Yeah.
Put yours on first.
Yeah, put
your mask on first. Yeah.
Otherwise, you pass out, and then you're not helping anybody. Right.
So, speaking of politics, we're going to talk like 30 seconds with this. There was a vote this week to overturn Governor Cooper's veto, and I'm curious to hear what you have to say, Stephen, in 30 seconds. There was S. Bill 37, I believe, that I thought was more of just a Republican ploy, gaslight, like HB2. We know that they're going to run on 2 issues: open schools in 2022. We didn't open schools fast enough. And that's kind of their thing, because those are things that they find out like 2 years ago. So they passed SB 37 here in North Carolina, which was going to mandate that all schools open, and it would override, in my view, curious how you view this, Stephen, it was going to override local rule. So CMS could say one thing, Union County could say whatever was best for their communities. It was going to override those. So they passed it. Governor Cooper vetoed it because he said the science doesn't show at this time that we should open schools fully for high schools. maybe middle schools and elementary schools, but not high schools yet. So they were not able to override it by one vote of all the Democratic senators. Yeah, all the Democratic state senators. And you remember in the last 2 elections, Democrats have been saying, vote blue no matter who. We need to kill the majority in the state house and state senate so we can override Governor Cooper, or we can protect Governor Cooper's vetoes. Remember all of that? Well, one senator from the Fayetteville area voted with the Republicans to override Governor Cooper's veto. And we're gonna say his name. His name is Senator DeKirk, I believe. He's out of the Fayetteville area. I know who he is, and his explanation was very, in my view, white-splaining. What I call white-splaining. It was, I was looking out for the marginalized communities, and I know how it's impacting. And this vote wasn't just about my constituents; it was about constituents all around the state, and this. So of course, me, I was like, that's so full of BS. I mean, the whole reason people voted for you was because you said you would hold Governor Cooper's veto. That was the whole reason to vote for Democrats, because we knew Republicans would do these kind of things. And of course, people are saying, oh, he represents everyone, all the same stuff. And it's usually white women. If you go to the social media pages, it's white women who are posing as unaffiliated. We want people to reach across the aisle. So Stephen, in 30 seconds, how do you feel about, I don't know if you know about SB 37, but how do you feel? Because I believe they're going to try one more time next week, because one of the state senators was absent, and they're going to try one. If he holds his vote to override and the other person votes, it will override the veto, and there will be a mandate that local school districts don't have a right to say about that. If he goes back to holding Governor Cooper's, then I don't know if they can override it. So Stephen, what do you think?
30 seconds or less. North Carolina
Yes.
does not have home rule. It's a Dillon rule state. So what Raleigh says goes. I don't like that. I'm a big fan of home rule. I think Mecklenburg County knows what's best for Mecklenburg more so than the people in Raleigh, just like the folks in Carteret County know what's best for them. The folks in Buckham know what's best for them. The folks in Union know what's best for them. I'm a big fan of local control. So I am adamantly against any policy that comes from Raleigh that overrides what people in local communities want, whether that's city or county. And that's just my opinion. And honestly, I think all the politicians in Raleigh are garbage.
Hey, that was within 30 seconds. Excellent, wonderful. Well,
I've been practicing.
Yeah, so this is really important for everyone who may not be paying attention to a lot of this. SB 37 was passed. It was vetoed by the governor. The veto was held, but they may be having one more vote. If you want your local school districts to determine what's best for your school district, which is what we've been talking about. I've been talking about not opening them, but I've compromised to kind of Stephen's libertarian point of view about home rule, those kind of things, because just when I said home rule should dictate, I could hear Stephen in the back of my mind, you're right, home rule, Governor Cooper shouldn't tell people about wearing masks.
And Christian, I agree with you. The public schools should stay shut down forever.
Yeah. Well, I mean, but anyway, if this is an important issue to you, this is something that's happening in North Carolina. Contact this Senator DeKirk's office in Fayetteville. He is a Democrat. He's a very he told people he was a very progressive Democrat. And the only reason that I can think that he would be doing this is because there's redistricting that's going to happen. His district is going to be redrawn. Hope Mills area leans a little bit more. 2022. Yes, he's thinking about 2022. He wants to hold on to his seat. He's not thinking about black and brown kids. So people need to stop calling him out. This white guy saying, "Oh, I'm thinking about no, you're not." He's thinking about saving his seat. He's thinking about going into his new district and trying to win a lot of these Republican voters that he's going to move into their district. And he's thinking in advance. And so
politician being self-serving, I'm shocked.
Showed up with 5 years of it. Oh, God.
And basically, in my view, he's also saying that every scientist in this state, like Dr. Cohen, I know more than they do. And I'm going to vote to override their science and their belief that elementary and middle schools, it may be safe because the governor has come out and said, let's open the schools, but elementary, middle school start and then go to high school. So what he's saying is, I know more than those scientists. And to me, that is arrogance, and we need to hold them accountable. So with that said, we're going to close up on the coronavirus in America. 30 seconds, and then we're going to talk about Joel Oldham so we can end the show. Anybody else want to add how the COVID-19 has changed America? I mean, it's obvious.
Well, I'll say to speak to something that Dr. B said about telemedicine. You know, there were lots of rules that were in place that kept medical services from providing things that people wanted for apparently no good reason. And when COVID happened, a lot of these rules went away, right? Yeah, well, that's not a good reason, in my opinion, right?
Oh, yeah.
But a lot of these rules went away. Like, for example, the prohibition on telemedicine went away. Well, why was it there to begin with, right? And there are a lot of policies that were that were just put upon the medical industry saying, you can't do X, Y, and Z because we say so, because whatever lobbyists, helped me get reelected that year. So I passed this law. Hopefully, as time goes on, more people see the need for those sort of onerous regulations to be rolled back so that people have choice and options in the kind of medical care they want. And doctors and physicians and medical care providers have more options and choice in providing services to the people who need them as well. Because it's a two-way street, right? If you can't buy it, then the doctor can't supply it, and then that hurts both people. But if you have the ability to get the care you want, it helps both people on both sides of that transaction. So that's a good thing. We should encourage that, especially in medicine, in my opinion.
Yeah. One more little thing that I think is going to be very interesting. The reports are that there has not been a flu season this year. That normally the flu that comes through and kills 30 to 40,000 Americans every year hadn't happened. And people say it's because of these simple, the W's, to washing your hands, keeping your distance, wearing a mask. So it's going to be really interesting. I mean, I'm not sure I ever want to shake anybody's hand again. And I'm going to be careful about how casually I kind of hug people. I don't, I'm going to wear a mask even after I start going out to restaurants and stuff. How long? And it's going to be very interesting, the degree to which this changes societal interactions for our own, ultimate health benefit. So that's going to be another very interesting thing to watch, is how our little interpersonal behaviors become permanently altered because of this experience.
I'll be sure to give you a fist bump, which is much more sanitary.
Oh,
if
man.
I ever have the
Elbow.
opportunity,
Elbow.
yeah, or that.
Elbow. Yeah,
If I ever have the opportunity to meet you in person.
I don't know where your fist might have been, but I have a pretty good idea your elbow's probably safe.
In the middle.
Oh, you don't know me very well.
Hey, Barbara, you want to say anything 30 seconds before we jump to Joel?
I am waiting for the CDC guidelines for all of us that are now. We have both of them. I want to see what they're going to tell us we can do. And I bet I'm not going to agree with it, but I'm looking forward to it, because yesterday was a birthday of one of our older friends, and she braved the cold and sat on a patio with a blanket over her so we could go out and have lunch together. She was miserable. And then she goes, well, I don't have COVID. I've already had my 2 shots. I said, you've only had your second one for 3 days. Forget it. And she wanted to hug everybody, and we're all like, no, like, no. She's a hugger, and she misses it terribly. She's in her 80s. So maybe she says, I'm not going to have much longer to hug everybody. And then you feel bad, but no.
Mama Ruth, you want to say anything before we switch to Joel Oldham?
Can we just go back to our normal life?
I don't think
I don't know what normal is.
Yeah, I don't think it's going to happen.
I'm game.
I don't feel it anymore.
New normal.
I agree. I agree, Dr. B. I think we're all going to start just being a little bit more careful, just in general. There was a time where I remember where we had people who came over from Asian countries who were wearing masks, and we used to just kind of kiki at them. Y'all remember that?
Absolutely.
We thought Michael Jackson was a freak because he was wearing a mask, if y'all remember that. And now I think, I don't think it's going to come easy for a lot of people. There's always this, I'm an American, I'm not going to do that. It's taking my liberties away, but I do think that there are most individuals who are concerned about protecting themselves and protecting their families and protecting.
I think our biggest mistake and biggest problem we have as human beings, or the lack of information or the lack of education. When you go into history, you find out how many pandemics been going on, and there's pandemics throughout every single year in different around the world. So the more we are ignored or we kind of don't want to realize or don't want to know about it, that's why we start freaking out. But there's pandemic all around the world every single year.
I think I can get something that we can end on that we all agree. Back in January of 2020, I hope, we'll see, I'm always looking at Stephen when I say this. And back in January of 2020, President, who will not be named at that time, said, this is just like the
Greatest
flu.
president ever.
Yes, this is just like the flu. It'll go away when it gets warm. It's nothing. It's just like the flu. Can we agree that this was nothing like the flu?
Oh, nothing like the flu.
I mean, I don't know. I'm waiting for the last.
Not at all.
I don't know. Can we?
It
There's-
changed the whole world. It's nothing like the flu.
I think this is. I'm not in that president's mind. I think what he was not. I don't think he was saying it was just like the flu, like it was transmitted. I think what he was thinking was deaths. He was thinking there's going to be 30 to 40,000 deaths just like the flu, because that was the talking points from people who followed him. That there are 30, 40,000 people die of more car wrecks in a year. There was, remember all those talking points? And so there was like, the talking point was to convince us there's deaths anyway. They're going to happen anyway. Don't disrupt your life. That was the talking points, because he didn't want any casualties, because that
Sounds just like Stephen.
So what I'm saying is that now that we passed 500,000 deaths in America in climbing, and maybe climb up to 600,000, can we at least agree that there were a lot of deaths?
Oh.
I mean, this is not something, this was a bigger thing that any of us expected. I mean, is that
In
one
the
thing?
United States, certainly, and probably because of a lot of the comorbidities that Americans tend to have.
Oh, no, it's not the comorbidities. It's the fact that there was no leadership and nobody kind of did the right thing. And so many people kind of blew it off. That's the reason. It doesn't have a thing to do with comorbidities. It's just that we ignored a serious problem.
Yep.
Comorbidities are not a non-trivial problem, though.
True.
And if you compare the
Right.
US to other countries as like a per capita thing, you see that there is a difference between countries that
Okay, well
Gee,
then
you got frozen.
let's
I
all
think the
agree.
gods accidentally froze you.
He did freeze. So let's Stevie, when you see this show later on, you're going to realize the interestingness of this. So let's all agree that
Shot from God. Shut
we
you
can
down.
end this, and let's talk very briefly about someone who was a special person to all of us, became a special person towards the very end, because he was on our show 11 times. Joe Oldham was on our show, and as I went back at our 124 shows, I believe 26, I can't remember, I have to double check. I think we've had 125 shows. He was on 11 shows. The first time Joel was on our show was show number 102. He was on our show on September the 30th. I can't believe it took him that long to come on our show. I thought he was back in 2019 at one time. I don't know if he.
So
I don't remember him then. No.
Yeah, I was trying to remember. I tried to code all of our shows for cataloging, and I couldn't find his name. So I went through some shows, and I was fast forwarding through and the name of that show was LatinX and Black Charlotte Part 2. Are we allies or adversaries? And there are 11 shows that I've gone through, and I've watched them, over 12 hours plus the other shows. And, the tribute that we'd like to give to him, that, we'd like to do a week from Thursday. We want to play some of those, because he was very insightful in how he taught me a lot as well on some of the things that he talked about, specifically kind of how to deal with people who maybe not agree with you. But, I say he was a wise soul,
Yeah.
or an old soul,
Yeah.
So just to let you know, this Friday, March the 5th, at 6 o'clock, there is a candlelight vigil at the Northwest School of the Arts. It is this Friday, March the 5th at 6 o'clock at the Northwest School of the Arts. That's at 1415 Bettysford Road. If you'd like to attend that, there are community members that are holding that, NAACP, Lucille Puckett's group as well. They're going to be doing that there. And then on Saturday, the 6th, I had the time wrong. I apologize. The viewing starts at 11 in the morning. That is at St. Paul's Baptist Church. It will be live streamed, but it is on March the 6th, this Saturday at 11 a.m. at St. Paul's Baptist Church. It will immediately be followed by service, and I believe that service is for family members
Private.
only.
Yeah.
It's private.
Yeah.
Yes. So if you want to send flowers or something, please send it to the St. Paul's Baptist Church in Charlotte. But once again, there's a candlelight vigil on Friday, and then Saturday the 6th for this young man's life, to honor and celebrate this young man's life. The other shows he was on, our show, he was on show 103, where we talked about politics. Latina Power, he was on that show. He was on the Vote 2020 results. That was a funny show. I was watching it. He was on the holiday season show. He was on Can We Still Trust Our Neighbors? He was on that show. And then he was on a really funny one about another one. And then the last show he was on was the Friday before he passed, which was our special show. It was about Afro-Latinos. And it was great to have his perspective on that show as well. So I just want to play a brief clip of the first time he was on our show, and please bear with me. I'm not really good at sharing this. So let's see if I'm going to, tell me if you can see this. Can y'all see that?
Very good.
Yeah.
Excellent. Good
Okay.
job.
This is from my video editing. So we're going to play a little bit of the very first time he was on our show. Let's make sure I got that right. Let's see. Here we go.
Can you maximize it?
Yes.
Sing it, Christian. Sing it.
We're live, y'all. Again.
All right.
Stephen, you want to?
Cindy.
Yeah, I'll introduce. Welcome everyone to Coffee and Pan Dulce. This is your intrepid crew this Wednesday. We got Christian Cano, we got Joe Udman, we got Bar Bacon, and Cindy Lopez, and of course yours truly, Stephen DiFiore. And don't forget Baby Trump Pinata, who's to my left, but I don't know where he is on your screen.
Well, yeah, welcome everyone. I'm sorry, we're having technical difficulty because we're Mama Ruthless again today, and apparently I forgot to clean my browser and all that technical high-tech stuff. So welcome. Today is September 30th. Thank you everyone who's joining us on Facebook Live, but also those who join us later on YouTube, but also on Facebook as well. We have a special show today, our last show of September. Our topic today is going to be LatinX Charlotte and Black Charlotte, adversaries or advocates. And then we will also talk on the second half of the show about something that Dr. Bohmfalk, Dr. B, as we call here on the show, mentioned a couple of weeks ago about wearing masks and the benefits of wearing masks and herd immunity. It's interesting. Interesting to hear what Stephen has to say about that as well. So before we start, once again, we are going to go around. We salute first. I forgot. I'm really discombobulated. So let's go around the Brady Bunch. Let's salute to Coffee and Pandus. All right. You have a cup of coffee or whatever you're drinking.
Hello.
And yes, yes. And thank you. And we also want to thank Manolo's Bakery, who's our Pandus sponsor, Manolo's Bakery on Central Avenue. It always looks like there's a chunk missing, like I bit it off when I get it. Manolo's Bakery on Central Avenue, please visit your local small businesses. And it looks like Dr. B is joining us a little early. With that said, let's go around our Ready But screen. Oh, someone's got a haircut. Another one. Let's go around the Brady Bunch screen and introduce yourself. Once again, how we do it here is you introduce yourself and your imaginary button. We started just a little bit late, Dr. B, so just to let you know that. And on the Brady Bunch screen, it looks like we have Stephen, Joel, Barb, Cindy, and I believe Dr. B is last. So if you'll do that, it gives me time to share. So next.
Joel?
Oh, okay. Well, hello everyone. Hello everyone. I'm Joel Odom. I am a native Charlottean, 2019 mayoral candidate here in Charlotte. I serve on the board of Generation Nation, and also I am a CMPD explorer. I am with the Boy Scouts, and I am a faithful member of St. Paul Missionary Baptist Church, and I do a lot of community service and civic advocacy here in Charlotte. And if I were to have a pen, it would be Black Lives Matter and fight the power.
Morning, I'm Barb Bacon.
So we're gonna, before we get started, I just want to kind of, I don't want to spend a lot of time on this, but I just want to get everyone's response in 30 seconds. What did y'all think of the presidential debate last night? Who wants to say?
I'll go first.
Go ahead.
Yeah, really.
I really wish the Libertarian candidate Joe Jorgensen had been up there. I think it would have been a much better showing, and we would have seen how feckless and inferior and ridiculous the two parties are by giving us those two people as our options. 300 million human beings in the country, and that's the best we can do. I think we can do better.
I really had no idea what to expect, but I honestly did not expect that when Trump just started rambling, and it was like, what is he doing? And I thought maybe that was his intimidation tactic, but I was flabbergasted. I almost turned it off, and I thought, no, I'm going to watch it till the end. And when he did not denounce white supremacists, that just absolutely frosted me. And then you hear that his communications person this morning saying he did 3 times. He said, sure. But when it came down to say it and denounce it, he never did. And I already voted, so I was just trying to see what message they each were going to send, and it wasn't really clear because when you have so many people talking over each other, I just don't listen. And I think that's what the general consensus is. Although depending on which news channel you watch, some have Trump winning, others have Biden winning. I don't think anybody won that debate. It was a red hot mess. What do you think, Joel?
So in 30 seconds, I'm gonna try my best to compose. I thought the debate last night was very, very insulting to the African American community, especially when the president said, "I have done more for Blacks in this country than President Abraham Lincoln," and that is so insulting because it belittles what we have gone through as a people and as a nation. And it always throws me that a lot of people don't say, hey, he's not saying I have done more since President Johnson, who enacted the Civil Rights Bill to allow everyone in this nation to vote and allow because mind you, in the Civil Rights Bill, we have got a lot of rights, handicap rights, women rights. We have fought so hard for all people. And he always goes back to when it's only Caucasians and Blacks. And he's saying, well, slavery was just a walk in the park. I guess forget about the rapings, forget about tearing families apart, forget about the heartache and the pain, because apparently we don't feel pain. We don't feel the same feelings as him and his family. So it was very insulting to me. I think how he talked about soldiers, Joe Biden's son, both of his children, was very insulting. Very insulting. But Biden kept it high. And he said, we could go all night and talk about your children. And so, other than him saying? Telling the president to shut up. I do believe in my heart, I already voted just like you, Miss Bacon. So I voted for Biden. And whether or not, okay, hey, they might not be the best choice, I would rather pick someone that will sit up here and try to do something for blacks than saying we have already arrived and what you talk about, what you're talking about, and what you've been through means nothing. And I've done it all for you. So that's just my interpretation of it. It could have went a lot better. I just felt sorry for the anchor who had the moderator who had to sit there and try to regulate two grown men who are at the seat of power for freedom. And so I just can't imagine telling the president to shush and sir, be quiet. That right there just says a lot. Because I knew I couldn't take that job.
Well, that was the first time he was on our show, and we'll show many other clips, maybe not that long, but I wanted to show that entire clip because just that clip showed his, I mean, it's hard to believe he's 21, 22 years old, you know, and it was just, you know, a life left way too soon, but we'll play more of those on our tribute to him a week from this Thursday. Once again, one last time, the candlelight vigil for Joe Oldham is going to be on March the 5th, this Friday at 6 p.m. at Northwest School of the Arts at 1415 Betty's Ford Road. This is being put together by local community members who he was in part of and knew him, NAACP Charlotte, Lucille Puckett's organization as well, and some other groups. The viewing for by his family is on March the 6th at 11 a.m. at St. Paul's Baptist Church in Charlotte. Starts at 11 in the morning. It will be live streamed if you cannot make it, but it'll be there as well. So that's how we're going to end our show today. We're going to go around the Brady Bunch screen, and we hope to have all of you on if you'd like to participate in the tribute. I'll be all of the clips, shorter clips, but one of the things, and we can talk about some of the things that maybe I learned from him. And one of the things I thought was so interesting about Joel was just his perspective about our Latinx community. And when we had the thing about Latinx, in another part of this clip, he said that he went and looked up the term Latinx because he wasn't too familiar what that term meant. And I just assume everyone knows why we use Latinx and Latinx. And not everyone knows it. Not even Latinos know why we use Latinx and how we started using the term Latinx. And he said he thought it had something to do with like Malcolm X. And so he had to look it up, and then he explained it, you know, kind of told me. But when I saw that, I thought to myself, I live in a bubble. I just assume that everyone else is talking about everything that I'm talking about. And so as we talked about, I said, you can use the term Hispanic or you can use, the reason I say that was because I went through the exact same thing when I moved here to Charlotte, when I got involved in the NAACP and some other groups I always use the term African-American. And I had a person tell me it's okay to use the term Black. And I didn't know what term to use, African-American, Black, and there's certain times it's appropriate, you know, those kind of things. So it's just interesting that he's willing to learn about it. And I didn't even take the time to learn about it. And it's just showed he was very similar to Stephen. He reads a lot, tries to get as much information about what's going on. But he was the first person that came on our show that actually did his homework. And so I was so impressed that we told him the topic and he looked it up because he said, I looked it up and I did this. So anyway, we're going to be talking about that. So let's go around the Brady Bunch screen. And once again, you know, we'll have that a week from Thursday. Tell us where you're going to be and we'll end the show. Brady Bunch screen is St. Bernie has been sitting quietly on the corner still with the candles and the rosary. He's been here for a while. We may have to come up with someone else. And then we have Dr. B, Barbara, Mama Ruth, and we'll end with you, Stephen. So go ahead.
Great. I'm going to be looking forward to the introduction in Congress in the next couple of weeks of the new 2021 Medicare for All bill. So there's going to be a lot of attention on that, and hopefully it'll move along, and it's going to be a big thing to kind of watch. And I continue to participate in a lot of interactions like this for Black Lives Matter, and how to do a better job at anti-racism, the option of which is doing nothing and continuing to exist in a racist system. So that's what I'm going to be doing, and staying largely at home and staying away from people and washing my hands.
I'm with you, Dr. B. I am working right now with a nonprofit. I'm trying to help them get their 990 form ready for their 2020 taxes. So I'm trying to brush those cobwebs off and help that organization. And one more person to drive for a vaccine. And now my family in Illinois is having a heck of a time getting appointments. So since I'm an hour ahead of them in time, I'm on websites looking for them and trying to help them. So that's what I'm going to be doing. And I'm also staying home until the CDC tells me I'm safe to go out and do things. And then I'll consider what I'm going to do and what I'm not going to do. So, and that's supposed to be sometime today or tomorrow. So
I'll be home. I'll be home just recovering and watching to see what changes are coming up. With Dr. B as well, watching all those new Congress proposals and bills that are being presented. And that's it. Y'all have a great week.
I'll be working. Obviously, I probably need to save up some money and buy a new computer because it keeps crashing on me. Goodness gracious. Hey, but I got a cool cell phone, so that helps.
Hey.
This is a convention season for the Libertarian Party, so I'll be busy in that. And I will say, Christian, giving me the comparison to Joel is quite the compliment. Thank you very much. The last time I saw Joel was he was actually buying ice at the store I work at. I look up and there he is. I'm like, hey, Joel, how's it going? And we're like, oh, wow, how about that? And he, was just, going about his life. Happy, excited for the next big thing, and I'm going to choose to remember him that way always.
That was, I've seen a couple of pictures and people have posted. He is one of the few people in politics and he was so young, but just a few people in general that met so many people, and we all knew him or met him, and we all had, this is a good guy, had a positive, it's so, we all strive to live, to just be considered a good person, or at least I do. And he was one of the persons that was like, wow, I was trying to look to see if I could find somebody who would say, well, Joel, we always have, Christian, but, so anywho, I'll be hopefully attending the candlelight vigil, but also the viewing on Saturday. I'll be here doing yard work until spring starts, and then we'll be here next week. And that, yes, thank you, Stephen, for reminding us. Precinct meetings are happening in all parties: Libertarian, Green, Democrat, Constitution. I'm sure Republicans. Hopefully, they'll get a new a chairperson. The Democratic Party just elected a brand new state chairperson. Our first person of color. She is a woman. I hope that is major changes for our party here in North Carolina. And then we will have county elections, I think, in a month as well. So maybe we can continue that change here in North Carolina. I will be wearing 4 masks in honor of Steve, just so that way, I think 2 is the limit. I've tried 3 just to be funny, and I was like, it was like a big a doodad.
A big depend on your face.
Well, it is. That's right. So thank you for joining us on Coffee and Pandusi. If you're on this
Thank you to Maria Medina for greeting everyone. She posted on our page. Thank you for watching our show and sharing the page.
Yes, thank you. So stay on. We can do the promo, and we're going to leave. And wait, I'm not going to turn the music on because of technical things. So see you next week on Coffee and Pandusi. Bye, y'all.